Texas law already bans most abortions, but on election day, voters in Amarillo considered going a step further. A ballot measure called for adding restrictions on women trying to leave the city to get an abortion. Proposition A would have made it unlawful for a woman seeking an abortion to travel through Amarillo. It also would have made it unlawful to possess abortion-inducing drugs. People accused of violating the ordinance could face lawsuits. Supporters tried to get the Amarillo City Council to adopt the ordinance. When that failed, a petition put the proposition on the ballot for voters to decide. On Tuesday, voters said no, with 59% voting to reject the ordinance.
Read the ordinance, listen to what we had to say, and understand at the end of the day, this is a restriction on your right to bodily autonomy, freedom of speech, medical privacy, and right to interstate travel.
Supporters of the anti-abortion ordinance say they'll keep pushing for ways to stop what they call abortion trafficking.
We're going to fight for unborn children, but we're also going to fight for women who are the victims of abortion abuse. Women who don't really want abortion, but they're being pressured to get abortion by men who are trying to force them to get those abortions.
Backers of the ordinance vowed to work to elect new council members who would support future efforts to pass the measure. A former Democratic state representative who helped reform the Texas Medical Board in response to our investigation is heading to D.C. Congresswoman-elect Julie Johnson of Farmers Branch called her bipartisan bill, which became law last year, one of her proudest accomplishments. That law prevents doctors who've had their medical licenses suspended or revoked in other states from practicing in Texas. It also mandates round-the-clock physician monitoring through the National Practitioner Data Bank and public disclosure when doctors are disciplined. In an interview before she won the election, Johnson said she's eyeing broader patient protections in Washington.
I look forward to working with you on that. I'm sure that you and I can partner together just like we did with the medical board, and let's see what we can get done. Everyone who's committed to good medicine wants the safest environment to be a physician to practice as well as a patient to receive care. And so from that lens, we will always look for opportunities to improve that.
Johnson said she wants to look into whether any data bank records should be made public and look into whether there should be a national transparency law to help patients make more informed healthcare choices. Thank you again for joining us for State of Texas. I'm Josh Hinkle, and we'll be back next week to bring you an in-depth look at Texas politics.